Okay, in today's health headlines, we're focusing on two big topics, the virus and ticks. State epidemiologist Dr. Benjamin Chan joins us live via Skype right now. Dr. Chan, let's get rolling with those ticks. It's something we all have to be paying attention to as we spend more time outdoors. What are the recommendations that you have for preventing tick bites?
Yeah, so it's important to remember that COVID-19 isn't the only risk that's out there to people's health, right? We're entering a time of year where the snow has pretty much melted, is gone. And when that happens, ticks come out. And so anybody that is outdoors is at risk potentially of coming into contact with ticks and tick bites. And there are a number of different infections that can be transmitted through specifically the black-legged tick, formerly called the deer tick in New Hampshire. And so there are steps that people can and should take when they're outdoors, staying active and healthy to prevent tick bites. And there are a number of steps. You know, the easiest is to obviously avoid habitats where ticks can live. This includes wooded, grassy, brushy areas. When people are outdoors, it's important to wear long pants and long sleeves. Now, that's easy this time of year because the weather is cooler, but this remains important as the weather warms up. And then we recommend that an insect repellent that's effective against ticks be applied to any exposed skin. Formulations with DEET are usually most effective, but there are other formulations that work, like oil, lemon, eucalyptus formulations of insect repellent. There are also sprays out there that are meant for clothing, permethrin type sprays that can repel ticks. And so if someone's wearing clothing outdoors, especially if they're working outdoors for lengthy periods of time, spraying clothing with some of these alternate sprays can be helpful. And then there are other personal steps that people can take. So tick checks on themselves, their children, their pets when they come in from outdoors. Showering to remove any loose ticks, and then throwing dry clothes in the dryer on high heat for about 10 minutes will kill ticks. Now, if the clothes are wet or washed, it will take longer, but drying them out in the dryer is the best way to remove ticks from clothing.
All right, doctor, enough of that creepy crawly video. Let's move on to the ever-present virus. 99 new cases yesterday was kind of a punch in the gut when you first heard that number, but you immediately said this is not a surge. Can you explain that?
Yes, so we are reporting the number of new positive cases every day on our website. So people can go on our website and see the updated numbers. Those numbers simply reflect the people that we have tested and identified with COVID-19 infection. We believe that the number of infections in our community is likely much greater than what is reported and tested and reported on a daily basis. And so, yes, you're correct that 99 new people were diagnosed with COVID-19 that were reported to us yesterday. That's higher than we have reported typically, but I believe that reflects an increase in the testing that we're currently conducting.
All right, and what kind of symptoms right now should people be watching out for?
Yeah, so for COVID-19, you know, the symptoms of COVID-19 can be pretty varied. It's most commonly presents with upper respiratory infection that can include cough, runny nose, sore throat, certainly difficulty breathing, although that usually occurs later in infection. People can begin with a mild flu-like illness, so muscle aches, fatigue, perhaps, possibly even fever. One of the new things we're finding out about this infection is that people can actually lose their sense of taste and smell. So, you know, I think any of these symptoms are potential warning signs, and certainly if people are feeling ill or not well, they should be in contact with their healthcare provider. As I mentioned, we're working on trying to ramp up the ability of providers and facilities in our communities to be able to test people that are symptomatic. That becomes important not only to better understand how widespread infection is, but it's a tool to try and respond to clusters of infection and suppress infection.
All right, Dr. Chan, thank you. Great information.